Joining me today to talk about the issue of fibroids and how it affects us women, especially in our community, is Dr. Steven Zimberg. Dr. Zimberg, thank you for joining us. Will you please introduce yourself to our listeners and tell us what your area of expertise is?
I'm Dr. Steven Zimberg. I'm the director of minimally invasive gynecology at Cleveland Clinic, Florida. And I work in areas of fibroids, endometriosis, pelvic pain, the minimally invasive hysterectomies and robotic myomectomies, a wide variety of minimally invasive options for ladies so that they don't have to undergo large open procedures for many of the common reasons that they need medical attention.
That's very impressive, Dr. Zimberg. And are you out of the Cleveland Clinic in Weston? Is that your location, or are you at other locations as well?
No, I'm at Cleveland Clinic, Florida, at the Weston location, and that's our primary office, or my primary office.
Okay, very good. Now, right off the top, you mentioned the minimally invasive procedures. That's what you specialize in. What are or what is the range of procedures that are the options for women who are suffering from fibroids?
Fibroids have a number of treatments. Just because you have fibroids doesn't necessarily mean that you have to have surgery. If they're not bothering you, if they're not causing heavy bleeding or infertility or making a big bulge in your abdomen, you can actually watch them as long as they're not growing very rapidly. Fibroids can, many women have fibroids. Probably, at one time or another, almost 40% of women will develop fibroids at some time in their lives. And they can be very small and not cause any symptoms at all, or they can be huge, the size of a pregnant, abdomen at the time of delivery, or even bigger. The conventional, there's several procedures that can be done if you do need an intervention. The traditional procedures have been to do an open procedure, much like a cesarean delivery, and take the fibroids out and put the uterus back together if a woman wishes to maintain her reproductive options. If you don't wish to maintain reproductive options and you're having severe symptomatology, sometimes hysterectomy is performed for this. And then there's other procedures that are minimally invasive also that we offer at the clinic. One of them is uterine artery embolization, which is a radiologic procedure that involves blocking off some of the blood vessels to the uterus, which will decrease the size but not the number of fibroids, and may, if you're close to menopause and not having that many symptoms, you may be able to avoid having other surgical procedures done, by utilizing this.
Thank you, doctor. You mentioned that sometimes if the fibroids are smaller in size, there's no need to have any procedures. Are there any particular groups of women, cultural or ethnicity, or any other outside causes that would cause the fibroids to grow more rapidly in one individual than in another?
Not really. They tend to be more common in women of African descent, less common in Caucasians, least common in Orientals. We don't really know why that happens. And, no food actually makes it grow more, or it's generally, and everybody's a little different. Fibroids come from a mutation in an individual's cell in a woman's body in the uterus. And they're like snowflakes. If you have 10 fibroids, it's from 10 different mutations in 10 different cells, which is why they've never been able to develop, like a vaccine for it or something like that. So there's been a lot of research along those lines. Nobody can find the root cause. We know that the same process that allows you to grow fibroids will continue to operate in your life. And, if we remove fibroids, for instance, at one time to preserve fertility, you may well grow more fibroids later. We know that ladies who have not had children tend to have more fibroids than women who've had, 5, 6, and 7 kids. We used to see when ladies would have 10 children, you rarely saw really big fibroids because with delivery they tend to shrink down. But these days, with people putting off their childbearing till their 30s and 40s, later we're seeing a little bit more of it.
This is Marsha Wood with Doctor's Choice Talk Radio and Doctor's Choice Insurance. Here at Doctor's Choice Insurance, we write health insurance with all the major carriers: Humana, Aetna, Assurance, Blue Cross Blue Shield, you name it. We're here to help you every step of the way. 888-254-2995.
I've been riding since I was 17, flat out my whole life. Ran into a pretty serious medical issue. I was prescribed one drug one place, another somewhere else. Turns out if I'd have taken both drugs together, I'd have been in real trouble. But United Healthcare spotted the danger and warned my pharmacist in time. We only get one shot, and I want to leave this life exhausted.
We're more than 78,000 people looking out for 70 million Americans. That's health in numbers. United Healthcare.
We're back with Dr. Steven Zimberg. Are there any of the procedures that if someone is considering or definitely want to have children, should they avoid, or would you recommend certain procedures for women other than obviously the hysterectomy? No hysterectomy if they want to bear children, but other than that option, what are the options that are more suited for someone who wish to leave their uterus intact and maybe produce children later on?
The basic procedure, if you want to maintain reproductive options, is called a myomectomy, which involves removing fibroids and leaving the uterus intact. The other option would be there's a thing that's been out relatively recently called focused ultrasound, which involves trying to blast the fibroids with an ultrasound guided beam there, but the problem is the failure rate is extremely high for that, and many insurances don't cover it, so it hasn't really gained any popularity. It's not probably the best choice for most people. So it boils down generally, if you want to maintain reproductive options, to removing the fibroids through myomectomy. Now, this can be done either through an open procedure, where an incision, like either a up and down incision is made or a bikini type cut is made, and the fibroids removed and the uterus put back together. Or for most of our procedures that we do here, we do them laparoscopically, that is through the little tiny incisions, and we'll often use the robot to help us with that. The robot's been a wonderful sewing machine, and you can actually reapproximate the layers very well and very quickly with that after you've removed the fibroids, and the patient can go home either the same day or the next morning.
Dr. Zimberg, what would come into play where you would make a decision to either do the cut in the abdomen up and down or otherwise, or use the robot?
It depends on the size and the comfort level of the surgeon. At Cleveland Clinic, we tend to do bigger fibroids, so we can do 5-month pregnancy size fibroids with the robot. A lot of people would, if you're not doing the big ones, then you may have to open that. You got to do what's best or most comfortable for your surgeon. If your surgeon's most comfortable with an open procedure, that's the best procedure for you. If we're able to do it as long as the uterus is mobile and not too much above the belly button, then we can generally do it laparoscopically and remove the fibroids. And like I said, again, you'd go home the same day or the next day with that. If the uterus is so big that it's like the size of an 8 or 9 month pregnancy, there's no room to put the ports for the robot or for the regular laparoscopy, and you really need to do that as an open procedure.
What I'm understanding, and for our listening audience, just to clarify, whether it's the small incision done robotically or it's the cut in the abdomen, depends on the size of the fibroids in uterus and the comfort level of the surgeon. Is that correct?
That's correct.
Speaking of size, and you mentioned earlier about the growth rate, and since that would determine whether or not someone, has a larger scar or a smaller scar, we're all kind of vain these days. What are
Live in
the
South Florida.
yes? What type of symptoms should someone look forward to as they become larger? If someone has fibroids who are growing, what are the symptoms that they should watch out for?
Well, mainly what happens is you mainly get what's called bulk symptoms. It means if you can imagine a cantaloupe in your abdomen pushing on your bladder. People will get the tummy will pop out a little bit, and the ladies are thinking they're fat and they can't get rid of their tummy bulge. But when they feel it, it's actually hard, and that's lots of times the fibroids will push out almost like when you're pregnant, which is why we do the sizes by pregnancy sizes. We used to do it by fruit. We'd say like it's the size of an orange or the size of a grapefruit or cantaloupe or watermelon. But, again, everybody's definition of that is different. So that's why we use pregnancy sizes for this. Mainly it's pressure symptoms, pushing on the bladder, pushing on the back, bulging out of the tummy. If the fibroids are in the lining of the uterus, you tend to get very heavy bleeding with that. Pain when you have relations, feeling like you're real bloated all the time because as the fibroids grow and the uterus grows, it pushes the intestines up toward the diaphragm, so there's less room for them to function. So ladies feel real bloated and bulgy.
This is Marsha Wood with Doctor's Choice Talk Radio and Doctor's Choice Insurance. Here at Doctor's Choice Insurance, we write health insurance with all the major carriers: Humana, Aetna, Assurance, Blue Cross, Blue Shield, you name it. We're here to help you every step of the way. 888-254-2995.
I like their size,
I love their texture.
their shape, feel.
They complete me.
Big, small, it doesn't matter.
Yes, I like boobies.
Love boobies.
Yes, I love boobies.
Yes, I love boobies. I love boobs.
Most of us know someone.
Who's been affected by breast cancer?
My friend.
My piano teacher.
My sister.
My aunt.
My teacher. My two aunts.
My Aunt Rachel.
I beat breast cancer.
We can beat this together.
Show the world how much you care.
And join us in the fight.
Because it's more than just boobs.
It's life.
Again, we're talking with Dr. Zimberg from the Cleveland Clinic. He's mainly out of the Weston facility. He's an amazing doctor, as his credentials say, and a wonderful person. I've met him personally, and we appreciate you joining us today, Dr. Zimberg.
Thank you. My pleasure.
Thank you. What happens after the surgery? How is life affected? And how long is the recovery time? And are there any possible complications where, for example, someone might need blood transfusion or afterwards? What are the possible complications, and what are we looking at for recovery after a procedure to correct a fibroid situation?
The complications kind of depend on whether the procedure is done laparoscopically or robotically versus an open procedure. The biggest problem with any fibroid and uterine sparing procedure is blood loss. So we tend to get it's not uncommon that you may need a transfusion, particularly if you have very large fibroids. We have some ways to prevent that and narrow it, but it's more common after a fibroid procedure than after many other procedures. But in this day and time, we inject the uterus with medication to sort of shrink the blood vessels down so you don't bleed as much. We'll use, if they're very large, we'll actually have our radiology consultants do a temporary block of the uterine vessels that they'll do a day or two ahead of time so you don't get so much bleeding, particularly in a patient that's, for instance, a Jehovah's Witness. We'll often do that so that we minimize our risk of blood loss, with the very large fibroids. The main complications, like I said, are a little bit of some blood loss, and if it's an open procedure, it's fairly standard. You have risk of wound infection or injury to other organs. But you can see that and fix it at the same time. Laparoscopically and robotically, there's generally less of that, but you can, again, any procedure can cause risk of injury to other organs such as the bowel of the bladder, and injury to or leaking from blood vessels, no matter what kind of procedure that you do. Because the uterus, when we take the fibroids out, has a raw bed until we sew it up, you do tend to get some blood loss, again, with that. Infection rates are generally very low, particularly with the minimally invasive procedures, and the blood loss is typically low with the minimally invasive procedures. But again, sometimes you have to do the open procedure.
Dr. Zimberg, when I was at your office, I met two women who said that their life really changed and improved drastically after the procedure was done. And I bet you more women are very grateful to you after you've done that.
They only like me because I have chocolate on the desk. No. When you have something the size of, say, a cantaloupe in your abdomen, and it's pushing on your bladder and it's causing heavy bleeding, if you remove the mass, it takes the pressure off the bladder, it takes the pressure off the back, it takes the heavy bleeding that they get on a monthly basis down to normal levels, and generally people become, they can become anemic without, that, so they got more energy, and their figure comes back to normal. So, they're not pooching out and are able to wear the clothes you were talking about here in South Florida. So I think that's what they were referring to. But when you take the pressure off and the heavy bleeding gone, that makes your life dramatically better, and allows you to keep your reproductive options intact.
In regards to health insurance, are there any procedures that are not currently covered by health insurance other than the one that you mentioned before?
Actually, insurance covers pretty much all of the types, except for not all insurances cover the focused ultrasound, but the uterine artery embolization is covered, the myomectomies, either open or robotic or laparoscopic, are all covered by insurance, unless you've had one of those exclusion clauses in where when you signed up for your insurance and told them you had fibroids and they told you, oh no, we won't pay for that up front. Other than that circumstance, then yes, they're covered with insurance.
Okay, that's good to know. And so you mentioned the bloating, possibly heavy bleeding, maybe some backache. So if someone did not, haven't been going to their gynecologist and haven't been checked out, and they have those symptoms, so they should go and see someone and check, because all those symptoms. Are there any other additional symptoms that's associated with fibroids?
Other than bulk symptoms, if you're bleeding very heavy, you may be anemic and be very tired and fatigued from that. But people's definition of heavy is very different. Some ladies that go through 4 pads a day believe that they're flooding, whereas other people who go through 10 pads a day think that that's normal. Everybody's a little different, but if you're bleeding heavy, you can become very tired and lethargic. Some people get hot flashes with it, but lots of times women during different parts of their cycle get hot flashes.
Okay.
Even young women do.
And
but that's generally the cause. There are some medical treatments that have been used occasionally. Something called Lupron, which shuts down your periods for a while. That's for people that want to temporize, you can shrink them temporarily by about 20%, but as soon as you stop the medicine, they grow right back, and often overshoot. We don't tend to use that here, but some people use that to temporize, if you're 48 years old or 49 years old and want to try to shrink them and see if menopause makes them better. But about half of them will continue to grow in menopause. Everybody thinks they go away in menopause, but they don't. They'll shrink by about 20 to 30%, and a good 40 to 50% will continue to grow.
Hi, my name is Marsha Wood, and I'm with Doctor's Choice Talk Radio and Doctor's Choice Insurance. I'm here on BSN Radio Gospel, where I'll be coming to you live every Saturday morning from 7 a.m. to 7:30 a.m. I'll be talking with doctors from all areas of expertise, giving us all the information that we need to know, especially the ones that affect us in our community. Brought to you by Doctor's Choice Insurance. To reach us, you dial 888-254-2995. We're back with Dr. Steven Zimberg. In conclusion, Dr. Zimberg, is there any one or two things that our audience should know about in relation to fibroids and fibroid tumors?
Basically it occurs in lots of folks, and everybody either knows somebody who's got them or had them there. If the basic thing is, if you want to maintain reproductive options, then myomectomy is probably your best bet, and for the most part, we can do it minimally invasively, which is basically an outpatient procedure at worst overnight, and you're back to normal in about 10 days. If you're not interested in childbearing, sometimes the minimally invasive hysterectomies are better for you. With that, it's important to check if they're not bothering you and they're not causing a lot of symptoms. You don't have to do anything about them necessarily. They can certainly be watched if they're not bothering you.
Thank you so much, Dr. Zimberg. And again, this is Doctor's Choice Talk Radio, Doctor's Choice Insurance, speaking with Dr. Steven Zimberg. Dr. Zimberg practices out of the Cleveland Clinic, the Weston location. He is an accomplished doctor, an accredited doctor, and he is one of the best in his field. Thank you so much, Dr. Zimberg, for joining us today.